Now it's time for On Point, where we speak to experts to delve that little bit deeper into the biggest news stories in the spotlight right now. And of course, it is this new variant of COVID-19. It's called the Omicron variant, detected in South Africa last week and has since spread to numerous countries, as we just reported on. The news sparked fresh fears. It caused stock markets to tank and triggered new international travel restrictions to try and limit the spread.
It's expected to take researchers some time to understand Omicron, but the WHO has already labeled it a variant of concern. Now, this means it could be more transmissible, more virulent, or more able to evade the protection granted by the vaccines we currently have. And this is all the more concerning as new cases continue to rise in South Korea, like we said, along with the number of critically ill. So officials are probing the idea of reintroducing tougher restrictions today. For more on this, we connect to Dr. Alice Tan, internist at Ms. Midi Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
Well, it's still early, but what do we know so far about the Omicron variant?
Well, as was reported, we don't know that much, but it was first reported by South Africa to the WHO on November 24th, but the first known confirmed case was from a sample that was collected on November 9th. So what this means is about 3 weeks have already elapsed since the first known case. What's most concerning is that there is a large number of mutations in the Omicron variant. So there are 30 mutations, 30 amino acid changes in the spike region, including 15 changes in the receptor binding domain, and also 20 mutations in other genomic regions. So 50 mutations in the entire genome that have been changed from the original Wuhan variant. And so this is very concerning indeed. And as I mentioned, already 3 weeks have passed since the first known case. And so this raises the possibility, the very high possibility that this variant has already circulated the globe widely. And we should also keep in mind that Johannesburg, which is sort of the epicenter of the growth of cases in South Africa right now, is a major international transportation hub. So that just increases worries more.
Yeah, we just heard a couple of American airlines are saying that they are going to keep their flights between South Africa and the United States open for the time being at least. So that's a concern there. As you touched upon, scientists are saying that this has a very unusual kind of mixture of mutations going on. And this may actually help it bypass our immune systems, make it more transmissible and less treatable. But like you say, a lot of unknowns at this point. Are you concerned that this strain could make the current vaccines we have completely ineffective if it becomes the dominant strain?
Well, in terms of transmissibility, let's start there. It looks like it may overcome the Delta variant. On November 8th, South Africa recorded about 117 new cases. By November 27th, that number of new daily cases was up to 3,220. That's about a 17-fold increase in 19 days. And 70% of the genetic sequencing that was done in the province surrounding Johannesburg, 70% of the cases were found to be of the Omicron variant. So it had overcome the Delta variant, essentially, in the Gauteng province. So I think that it may overcome the Delta variant worldwide. In terms of immune escape and whether or not it'll make vaccines completely ineffective, I don't think so. I think that vaccines will still offer some degree of protection against hospitalization and death, even against the Omicron variant. And so I think this is a warning call for all countries to try to get their vulnerable groups vaccinated as quickly as possible and deliver boosters as quickly as possible. But there may be some waning of immunity, vaccine-induced immunity, and that why Pfizer and Moderna are both working on revised or updated versions of their vaccines.
And also, Dr. Tan, what steps do you think the South Korean government will take as part of its emergency response plan that will be announced in the coming hours? And what steps have already been taken to stop the Omicron variant entering the country?
Well, there's been a travel ban on 8 southern African countries that was issued over the weekend, but we should realize that travel bans, they do not block the entry of variants, they just delay the entry. And we should also keep in mind that there are other countries in Europe, Australia, Hong Kong, for example, Israel, other countries around the world that have already reported cases of the Omicron variant. So it really doesn't make much sense to just target Southern African countries when we know that the variant is already in other countries around the world. Basically, as I said, we need to really up our game in terms of booster distribution, protect our most vulnerable groups against COVID-19, because right now that's the best defense. In addition, we have all of the non-pharmaceutical interventions that we know work, and we know that these work because they worked even before vaccines were developed. And so we really need to go back to the basics, I think, and tighten our restrictions, social restrictions, and our distancing that we had, of course, relaxed since November 1st.
And finally, just 30 seconds, if you can, how worried are you that the number of critically ill patients in South Korea with the winter coming up is just going to completely overload South Korea's healthcare system?
The South Korean healthcare system is already under tremendous strain. ICU capacity is over 80% in the Seoul metro area. We hit 75% nationwide. And every day for the past 3-4 days, we've had more than 1,000 cases who are aged 60 and above. So ICU beds will fill up, and then we have all of the other acute respiratory illnesses that will occur over the winter. So I am very, very concerned, and I hope the government does institute some measures to prevent our healthcare system from collapsing.
All right, Dr. Tan, as always, we're so grateful for your insights, and thank you so much for joining us.
Thank you.